Have you been noticing changes lately? Maybe intimacy doesn't feel the same. Perhaps you avoid it because something feels different, or you're deeply in love with your partner, but your body just isn't responding like it used to. If so, I want you to hear this. You are not broken, you are not alone, and you are not without options. I'm Dr. Sarah, a men's health specialist, and in my 20 years of practice, I've seen how silence and shame can weigh a man down. What you're experiencing is far more common than most men realize, and more treatable than you might think. Subscribe now, because this channel is a safe space for the conversations that matter most. Today, we're going to break that silence. I will walk you through what's really happening when ED enters your life, the physical causes, the emotional triggers, and most importantly, the actionable steps you can take to turn things around. What I'm about to share isn't about embarrassment, it's about hope, healing, and reconnection. This isn't the end of intimacy, it's a whisper from your body asking you to listen. Let's begin. I want to continue our conversation right where we left off. You're not alone in this journey, and what I'm about to share will help you understand exactly what's happening in your body and mind, and more importantly, what you can do about it. Let me start by telling you about Robert. Robert is 68, a retired electrician who's been married to his wife Helen for 42 years. He came to my office not because his doctor sent him, but because he was already working well with his primary care physician for his blood pressure. What Robert wanted was to understand why intimacy had become so challenging and whether there was hope for reconnection with Helen. I coordinated with Robert's medical team, and together we discovered that his body was sending him important signals. His blood pressure medication was playing a role, but there were also natural changes happening that we could support. Within 3 months, Robert noticed he felt more confident and energetic. His doctor was pleased with his overall health improvements. Today, Robert continues both his medical care and the natural approaches we implemented, feeling more connected to Helen than he had in years. Robert's story isn't unique. In my practice, I work with men every day who thought their intimate life was over, only to discover that their body was simply asking for attention and support. You see, when we understand what's actually happening, we realize this isn't about failure or aging, inevitably stealing our vitality. It's about listening to what our body is telling us. Here's what happens when erectile dysfunction enters your life. Your circulatory system works like a well-maintained plumbing system throughout your home. As we age, the pipes naturally experience some changes. This is completely normal. The small blood vessels that supply crucial areas can become less flexible, and the smooth muscle tissue that controls blood flow may not respond as quickly as it once did. Research from respected medical institutions supports what I see in practice every day. The process involves something called nitric oxide, which acts like a key that opens the pathways for proper blood flow. When this system faces challenges, whether from natural aging, medications, or underlying health conditions, you might notice changes in how your body responds during intimate moments. The wonderful thing is, this isn't a door that's been permanently closed. Your body has remarkable wisdom and resilience. When patients work with me and their doctors to support this natural process, they often tell me they feel more hopeful and energetic within weeks. The science is encouraging, and the real-world results I witness speak for themselves. But here's something equally important that many men don't realize. Your brain is actually your body's most powerful intimate organ. The connection between stress and physical response is far stronger than most people understand. When you experience worry about performance, your body produces cortisol, a hormone that works directly against what your system needs for intimacy. I see this pattern constantly in my practice. A man notices a change once or twice, begins to worry about it happening again, and this worry actually creates the very problem he's trying to avoid. It becomes a cycle where anxiety feeds on itself, making physical intimacy feel more like a test than a natural expression of love. This is where understanding becomes your greatest tool. When you know that temporary changes in response are normal and treatable, that worry begins to lose its power over you. Research, published in respected medical journals, shows that men who understand these connections and learn simple stress reduction techniques often see significant improvements in their confidence and physical response. One study I find particularly encouraging involved men between 55 and 75 who practiced mindfulness-based stress reduction techniques. These men reported a 30 to 45% reduction in performance anxiety within just a few weeks. What's remarkable is that this approach is completely safe and works beautifully alongside any medical treatment you might be receiving with your doctor. Let me share what happens when you practice simple breathing exercises before intimate moments. Your nervous system has two main modes, one for stress and action, and another for rest and connection. Deep, slow breathing activates that rest and connection mode, allowing your body's natural responses to work more effectively. Many of my patients tell me this simple technique helps them feel more present and less anxious during intimate moments. Now, I'd love to hear about your experience with managing stress around intimacy. Have you noticed connections between your stress levels and how your body responds? Share your thoughts in the comments. Your insights help other men realize they're not facing this alone. Beyond stress, there are physical factors that play crucial roles in intimate health. Your hormone levels, particularly testosterone, naturally change as you age. This isn't something to fear or fight against, it's simply information your body is providing about what it needs for optimal function. When I work with patients and their doctors to evaluate hormone levels, we often discover that supporting overall health naturally improves how a man feels both physically and emotionally. Research shows that men who maintain healthy sleep patterns, typically 7 to 8 hours per night, have significantly higher testosterone levels than those who sleep poorly. Your body produces testosterone primarily during deep sleep phases. When sleep is disrupted or insufficient, this natural production process is interrupted. Studies indicate that sleep deprivation can reduce testosterone levels by 10 to 15%. But here's the encouraging news. When men improve their sleep quality, they often notice improvements in energy, mood, and yes, intimate function within weeks. Charles, a 71-year-old former accountant, came to me feeling exhausted and disconnected from his wife Margaret, his partner of 45 years. We discovered that his sleep was fragmented due to an undiagnosed sleep disorder. Working with his doctor, Charles addressed the sleep issue, and within 2 months, he told me he felt like he had more vitality than he'd experienced in years. Margaret noticed the difference too, not just in their intimacy, but in Charles's overall enthusiasm for life. This brings me to something I discuss with every patient, the profound connection between your cardiovascular health and intimate function. The same small blood vessels that serve your heart also serve the areas crucial for intimate response. When we support your heart health, we're simultaneously supporting your intimate health. Research published in cardiovascular journals shows that men who engage in regular moderate exercise, like brisk walking for 30 minutes daily, experience significant improvements in blood vessel function throughout their entire body. This isn't just theory, I see the results in my practice regularly. The beautiful thing about this approach is that you're not just addressing one concern, you're supporting your overall vitality and health. When patients tell me they have more energy for activities they love, whether that's woodworking, gardening, or spending active time with grandchildren, they're describing the whole body benefits of supporting their cardiovascular system. Let me tell you about Daniel, a 66-year-old retired teacher who loves birdwatching with his wife Susan. Daniel had been avoiding hiking trails they used to enjoy together because he felt his stamina and confidence had diminished. We worked with his doctor to create a gentle exercise routine, and Daniel began taking evening walks with Susan. Within 6 weeks, Daniel told me they were back on hiking trails, and their connection had deepened in ways that extended far beyond the physical. What questions would you ask your doctor about supporting your cardiovascular health and intimate function together? Comment below your questions. Help me create better content that addresses what matters most to our community. Nutrition also plays a fascinating role in supporting the body's natural, intimate responses. Your body needs specific nutrients to produce nitric oxide, that key substance I mentioned earlier that helps blood vessels respond properly. Foods rich in natural compounds that support this process include dark leafy greens like spinach and arugula, watermelon, and beets. There's encouraging research on pomegranate juice that I often discuss with patients. A study published in medical journals showed that men who drank pomegranate juice daily experienced significant improvements in blood vessel health and reduced oxidation damage. The antioxidants in pomegranates help protect the delicate blood vessels throughout your body. However, I always emphasize to patients that pomegranate juice can interact with certain medications, particularly blood thinners and some cholesterol medications. This is exactly what I discuss with patients and their doctors because everyone's medication profile is unique and working with your medical team gives the best results. Similarly, research shows that ginger can support circulation through its natural anti-inflammatory properties. You can add fresh ginger to tea or include it in cooking. Again, if you're taking blood-thinning medications, you'll want to mention this to your doctor, as ginger can enhance those effects. The key insight here is that supporting your body's natural processes through nutrition works beautifully alongside medical care. Your doctor knows your specific health picture best, and they can guide you on which approaches are safest and most beneficial for your unique situation. Sleep quality deserves more attention because it affects so many aspects of intimate health. Beyond testosterone production, quality sleep helps regulate stress hormones, supports immune function, and allows your cardiovascular system to recover and repair. Men who prioritize sleep often tell me they feel more patient, more emotionally available to their partners, and more optimistic about intimacy. Creating good sleep conditions doesn't require expensive equipment or complex routines. Keep your bedroom cool, ideally between 65 and 68 degrees. Use blackout curtains or an eye mask to minimize light exposure. Avoid screens for at least an hour before bedtime, as the blue light can interfere with your natural sleep hormones. Some patients find that gentle stretching or reading helps them transition into sleep. Others benefit from keeping a consistent bedtime routine. The goal is to signal to your body that it's time to enter that restorative sleep phase where so much healing and hormone production occurs. Frank, a 74-year-old retired mechanic, struggled with frequent wake-ups during the night. We discovered he was drinking coffee late in the afternoon and watching television in bed. Simple changes, switching to herbal tea after 2 p.m. and reading instead of watching screens before sleep, transformed Frank's rest quality. His wife Carol noticed that Frank seemed more energetic and affectionate within just a few weeks. There's one more aspect I want to address because it's often overlooked but incredibly important: the role of pelvic floor muscles in intimate function. These muscles, located at the base of your pelvis, support proper blood flow and help maintain firm responses during intimate moments. Just like any muscle group, your pelvic floor can become weaker with age or lack of use. But also, like other muscles, these can be strengthened with simple, targeted exercises. Research published in international medical journals shows remarkable results. Men between 55 and 75 who practiced pelvic floor exercises for 3 months experienced a 41% improvement in intimate function. These exercises, sometimes called Kegel exercises for men, are completely safe and can be done anywhere without anyone knowing. To locate these muscles, imagine you're trying to stop urination midstream or prevent passing gas. Those are your pelvic floor muscles contracting. The exercise itself is simple. Contract these muscles for a count of 3. Then relax for a count of 3. Start with 10 repetitions, 3 times per day. Gradually increase to holding the contraction for 5 seconds as the muscles strengthen. Most men notice improvements within 6 to 8 weeks of consistent practice. William, a 69-year-old grandfather of 4, was skeptical when I first mentioned these exercises, but William was dealing with some bladder control issues in addition to intimate concerns, and his doctor had already recommended pelvic floor strengthening. After 2 months of daily practice, William told me he felt more confident in every aspect of his physical function. His wife Barbara noticed his increased confidence extended to their intimate moments together. The beautiful thing about this approach is that you're supporting multiple aspects of your health simultaneously. Strong pelvic floor muscles improve intimate function, bladder control, and even core stability for activities like gardening or playing with grandchildren. Now I want to address something crucial: the emotional and relational aspects of intimacy that often get overlooked when we focus only on physical function. In my experience working with couples, I've learned that intimacy involves far more than physical performance. It's about connection, communication, affection, and emotional availability. Many men tell me they've been so focused on fixing their physical response that they've forgotten about the pleasure of simple touch, cuddling, or intimate conversation with their partner. When we broaden our definition of intimacy to include all forms of physical and emotional closeness, pressure decreases and natural responses often improve. James, a 63-year-old retired postal worker, shared something profound with me during one of our discussions. He said that when he stopped viewing intimacy as a test he had to pass and started seeing it as quality time with his wife Linda, everything changed. They began spending more time talking in bed, giving each other massages, and focusing on pleasure and connection rather than performance. James told me this shift in perspective was more healing than any technique or treatment. Your partner's understanding and support play an enormous role in your journey. If you're comfortable doing so, consider sharing what you're learning about the physical and emotional aspects of intimacy. Many partners feel relieved to understand that changes in intimate response are normal and addressable, not a reflection of decreased love or attraction. Research in relationship psychology shows that couples who communicate openly about intimate challenges and work together on solutions report higher satisfaction and stronger emotional bonds. This isn't just about physical intimacy, it's about deepening your connection and partnership in facing life's changes together. Some couples find it helpful to explore new ways of being intimate that don't focus solely on physical performance. Extended cuddling, sensual massage, or simply creating uninterrupted time for emotional and physical closeness can be profoundly healing and reconnecting. Let me share what I've observed in my practice about the men who see the most significant improvements. They tend to approach this challenge as an opportunity to take better care of themselves overall, rather than as an isolated problem to solve. They start exercising regularly, improve their nutrition, prioritize sleep, and often strengthen their communication with their partners. These men don't just see improvements in intimate function, they report feeling more energetic, more optimistic, and more connected to the people they love. They're not just addressing erectile dysfunction, they're reclaiming their vitality and zest for life. Michael, a 72-year-old retired firefighter, exemplifies this approach. When he first came to see me, he was focused solely on getting his performance back to what it was decades ago. Through our work together and his collaboration with his primary care physician, Michael began to see this as an opportunity to become the healthiest version of himself at 72. Michael started walking daily with his wife Dorothy, began cooking more nutritious meals together, and implemented the stress reduction and exercise techniques we discussed. After 6 months, Michael told me something I'll never forget. "Doctor, Sarah, I feel better at 72 than I did at 62, and Dorothy and I are closer now than we've been in years." This holistic approach, supporting your cardiovascular health, balancing your hormones naturally, managing stress, strengthening your pelvic floor, and nurturing your relationship, creates the optimal environment for your body's natural intimate responses to flourish. I want to emphasize something important. Progress in this area rarely follows a straight line. Some days you'll feel confident and responsive, others less so. This is completely normal and doesn't mean you're not healing or improving. Your body is relearning and adjusting, and patience with yourself is crucial. Many patients tell me that once they stop monitoring and judging every intimate encounter, they begin to enjoy the process of reconnection more fully. When the focus shifts from performance anxiety to pleasure, presence, and connection, natural responses often follow. The research I've shared with you today on nutrition, exercise, sleep, stress reduction, and pelvic floor strengthening represents decades of medical investigation into safe, natural approaches that work alongside medical care. These aren't quick fixes, but rather sustainable lifestyle changes that support your overall health and vitality. Your doctor remains your most important partner in this journey. They can evaluate whether underlying health conditions like diabetes, cardiovascular disease, or hormonal imbalances are contributing to your concerns. They can also assess whether any medications you're taking might be affecting your intimate function and discuss alternatives if appropriate. Some men benefit from medical treatments like oral medications, while others find that addressing underlying health conditions and implementing lifestyle changes provides the support they need. There's no single right approach, only what works best for your unique situation and health profile. What I want you to remember most from our time together today is this: you are not broken, you are not without options, and you are not alone. Your body is communicating with you, asking for attention and care. By understanding what's happening physically and emotionally, you're already taking the most important step toward healing and reconnection. The shame and silence that may have surrounded this issue for too long end here. You now have knowledge, practical tools, and most importantly, hope. Every man's journey is different, but the capacity for improvement and reconnection exists within you. If this evidence-based approach resonates with you, please subscribe for more practical wellness education that honors your relationship with your healthcare provider. Share this with someone who values both natural wellness and medical expertise, because no man should face these challenges alone. Remember, this isn't the end of intimacy in your life, it's your body's whisper asking you to listen, to care for yourself more completely, and to embrace the possibility of renewed vitality and connection. That whisper deserves your attention, your compassion, and your action. You have everything within you to move forward with confidence and hope.